The story of lost limbal dermoid. The authors don't have any financial interest. This is the story of a 5-year-old child who was brought by her mother for cosmetic correction of mass in the eye. On examination, there was a limbal dermoid of size 5 into 5 mm in inferotemporal quadrant of right eye. There were no other intraocular anomalies and systemic associations. Anterior segment optical coherence tomography showed only involvement of 1/3 of anterior stroma. A combined approach of simple excision with conjunctival autograft with corneal tattooing was planned under general anesthesia. Limbal dermoids are congenital benign tumors consisting of tissues of ectodermal and mesodermal origin, most commonly located in inferotemporal quadrant. They have a raised, whitish, finely vascularized, bulbous appearance. The slow-growing lesions can be associated with a decreased visual acuity due to astigmatism, obscuration of visual axis, and presence of coexisting amblyopia. Indications for surgical excision include astigmatism, involvement of visual axis, poor cosmesis, discomfort due to cilia, or disturbance to the ocular surface tear film. There is no clear evidence of what is the most appropriate surgical procedure and when it should be carried out. Patients request for removal due to psychosocial and cosmetic concerns. Various surgical approaches include simple excision or shaving of lesions, superficial keratectomy, lamellar or penetrating keratoplasty covering the conjunctival defect with multi-layered AMG and use of mitomycin C. Major risk of excision of limbal dermoids include intraoperative perforation, postoperative epithelial defect, postoperative scar, peripheral vascularization of cornea, suture-induced astigmatism due to lamellar keratoplasty. Simple excision or shaving of lesion or superficial keratectomy and lamellar keratoplasty has ended in poor cosmesis due to scar at the site of excised dermoid. Differential diagnoses include ectopic lacrimal gland, lymphoma, dermolipoma, epibulbar dermoid, episcleral osteoma, juvenile xanthogranuloma. So here we are describing a novel technique for cosmetic correction of limbal dermoids. This technique includes simple excision with conjunctival autograft with corneal tattooing using a tattoo gun. The conjunctiva is cut around the limbal dermoid and the tissue is slowly dissected in a lamellar plane with the help of scissors, followed by a crescent knife. The remnants of dermoid tissue were peeled and removed. The bed is cleaned completely to give a smooth surface. Small bleeding points are cauterized. Superior conjunctiva is ballooned using a balanced salt solution and conjunctiva is dissected from underlying tenons and conjunctival autograft taken. Fibrin glue applied over the conjunctival defect and autograft placed over it and spread uniformly. The corneal part is then smoothened with the help of a diamond burr. A small amount of type 2 pigment is applied over the excised part of cornea. The tattoo gun has a predefined needle which penetrates the anterior stroma uniformly. The tattoo gun is rotated in small circles over the area where the dye is applied. This process is repeated 4 to 5 times until the entire dermoid dissected area is completely filled with dye. Excess dye is washed with balanced salt solution. The surface is rubbed smoothly to remove the dye stuck on the surface. A bandage contact lens is applied for better healing of epithelium over the surface of dye. The excised mass was sent for histopathological examination and the diagnosis was confirmed. The patient became symptomatically free at 1 week and BCL was removed after 1 week. She was kept on topical antibiotics and tapering doses of topical steroids for 1 month. At 3-month follow-up, the dye was intact and cosmetic appearance maintained with no other complications. At 3 months, there is reduction in astigmatism with improvement in uncorrected visual acuity from CF 3 meters to 624 and best corrected visual acuity to 618. Similar procedure is done in another 8-year-old child who had 1/3 of cornea covered with choristoma. Mass excised followed by conjunctival autograft with fibrin glue, diamond burr polishing and tattooing the excised area over cornea with the help of a tattoo gun. Her preoperative vision was maintained CF 2 meters after surgery. She also became symptomatically free at 1 week and achieved excellent cosmesis. So this technique of combining simple excision with conjunctival autograft with corneal tattooing achieved excellent cosmesis and reaches to the expectations of the patients and their parents.